Again, when you do almost all your studies, um, you start with a parasternal long axis view. And this is a parasternal long axis view. Uh, okay, let me. Uh, okay, so this is the parasternal long axis view, and this view is obtained by putting the transducer or the probe in the third or fourth left intercostal space. The marker points towards the patient's right shoulder, and you just make minuscule adjustments to get images looking like this. Um, Again, your descending aorta. This is your descending aorta right here. You have to know that. The posterior wall. Okay. Below the posterior wall, you have your pericardium. Okay. This is the LV cavity inside here. This is the ventricular septum. It's your right ventricle flow tract. The mitral valve, the anterior leaflet of the mitral valve, the posterior leaflet is down there. And this is your aortic valve. Okay, so we're going to put it in motion, and you need to appreciate a couple of things. You see, in systole, the aortic valve opens, the mitral valve closes. In systole, the heart muscle thickens, and diastole, it thins. So let's have a look again. In systole, it thickens, diastole, it thins. In systole, your aortic valve opens and the mitral valve closes, and in diastole, the mitral valve opens and your aortic valve closes. Your ECG is on the bottom. Okay, if we put a marker at the onset of the QRS, then that will mark diastole. Okay, if we put the marker, say anywhere from the T wave, anywhere on the T wave, we usually use the mid T wave or the end of the T wave. That would be a systolic frame. Okay, so so your marker is right here. You can see the marker right there. This is at the end of the T wave. If you want to bring it back a little bit more, okay, so it's right at the T wave. This is a systolic frame, and it corresponds to what's happening in the heart. In systole, the mitral valve is closed and the aortic valve is open. Okay, systole, systole. Okay, as opposed to your diastolic frame, which is when if we put it at the onset of the QRS. Okay, at the onset of the QRS, your mitral valve is now open, the aortic valve is closed. So this is a diastolic frame. Again, when we're doing our measurements, we talk about our diastolic measurements. Okay, we measure at the tip of the mitral leaflet, and we use a line which is perpendicular to the plane of the LV. Okay, so that's very important. So if we draw a line which is perpendicular to the plane of the LV, it's gonna look something like this at the tip of the mitral leaflet. Okay, because the plane of the LV is gonna come like that. Okay, and then you measure your septum from there to there, and then you measure your posterior wall from there to there. Okay, you measure your aortic root also in diastole. Okay, so from the leading edge to the leading edge. Okay, so these are the measurements that you do in diastole. And diastole, we're talking about the onset of the QRS. So at the onset of the QRS, okay, That's your diastolic frame. The mitral valve is open, the aortic valve is closed. And then you're gonna get some systolic measurements. All right. So your systolic measurement, okay, you can do it at the peak of the T wave. So at the peak of the T wave, uh, that's a systolic frame. The aortic valve is open, the mitral valve is closed. The measurements that you're gonna get in systole, you're gonna get the left ventricular flow tract diameter, okay, the LVOT diameter. You're gonna measure the left atrium, okay, and you're gonna measure the LV cavity size in systole. Okay, so those are the systolic measurements. You can see that the thickness of the septum and the posterior wall is increased in systole. Okay, so in systole the muscle thickens and in diastole it thins. So let's put it in play again and you can see it. Okay, so in systole the muscle thickens, in diastole it thins. In systole the aortic valve opens, the mitral valve closes. Alright, so these are, we're not going to show you, or we're not going to discuss M mode just yet. We still do M mode. M mode is still helpful, but we're not going to do anything M mode just yet. Alright, so let's look at this. Alright, so you also measure the right ventricular flow tract, okay, or the RV. And, this is how it's measured. So your septal thickness in diastole, LV cavity size in diastole, and the posterior wall. Okay, so these are, we're not going to discuss color flows as well. Um, okay, again, the measurement of the aortic root is a diastolic measurement. Okay, it's not a systolic measurement. The left atrium, that's a systolic measurement, and the LV cavity size in systole, that's also a systolic measurement. So the only way you're gonna be comfortable with scanning is by practicing. So it's not something that you can read a million times. This is something you have to practice. All right. Again, if you need to look at stuff, you can zoom it. Okay, when you zoom, then you enlarge the area of interest. Okay, so the LVOT measurement in systole. So LVOT measurement is done in systole. We're not doing color. And of course, you do your left ventricular cavity size in systoles. It's a systolic measurement. So you have to be comfortable with your measurements because one of the things that you do in echo is measure stuff. You want to see if your chamber size and whatever you're measuring is within normal limits or is it abnormal. So this is your RV inflow view. So remember to get the RV inflow view from your parasternal long axis view, you just tilt your transducer towards the left axilla, okay? And you're going to get something look like this. So this is your tricuspid valve right there, okay? So this is the RV inflow view. All right, okay. So this is the tricuspid valve, okay? The right ventricle is on top and the right atrium is at the bottom, okay? This over here is the posterior leaflet of the tricuspid valve, and this is the anterior leaflet. So you have to be familiar with the different leaflets of the tricuspid valve, okay? Okay, again, the posterior leaflet is over here, and this is the anterior leaflet. Okay, and when you put it in play, you can see it. Okay, this is your eustachian valve right here. Eustachian valve, the coronary sinus is just above that, and inferior vena cava is just below. All right, so you have to know your views so that when you start scanning, you can identify things. Okay, it's color, we're not doing color with your RV inflow view. Okay, we're not doing Doppler as well. So this is your short axis at the level of the aorta. So to get your short axis, you're going to rotate the probe from the parasternal long axis position. You're going to rotate the probe clockwise, and about at the 1, 2 o'clock position, you're going to pull the angle of the transducer down, and you're going to get short axis at the level of the aorta. Okay, so you can see your aortic valve inside there. It's opening and closing. Your tricuspid valve is over here. Pulmonary valve is there. Okay, this is your right ventricle, the RV inflow view right ventricular outflow tract is there. Okay, and if you put it in play, you can see stuff. So this is your tricuspid valve over here. This is the septal leaflet and your anterior leaflet. Septal leaflet of the tricuspid valve, the anterior leaflet is right there. Okay, again, this is the right atrium right there. This is your interatrial septum. This is the left atrium. Your interatrial septum is adjacent to the non-coronary cusp, which is right there. This is the right and this is the left coronary cusp. Okay, when the aortic valve closes, it closes in a Mercedes-Benz sign. When it opens like a triangular configuration. All right, so let's. Okay, this it opens, so it's open in a sort of triangular configuration. You can see it's a triangular thing right there. This is your atrial septum, non-coronary cusp, the right and the left. So your tricuspid valve is right there. This is the septal leaflet, the anterior leaflet. Right ventricle is right there. This is your right atrium, atrial septum. This is your left atrium. So when the aortic valve is closed, it closes in a sort of Mercedes-Benz sign. Okay, open. Aortic valve opens, sort of triangular configuration. Then we put it in motion. This is your pulmonary valve over there. It's pulmonary valve. Again, you can see it opens in a triangular configuration. Close in a Mercedes-Benz sign. So you should have in your mind's eye what image you're supposed to get, and you just try and achieve that when you're doing your scanning. You try to achieve the view, because if you don't have an idea what you're supposed to get, you'll settle for anything. So you need to have a clear idea what image you should be getting. So that's your short axis. At the, um, so remember the angle of the transducer is downwards. Okay, we're not doing color. So this is short axis at the base. At the base, you have your mitral valve. The mitral valve is right here. This is the anterior leaflet of the mitral valve and the posterior leaflet. Okay, you can see. So to get the short axis level at the base, you're going to move the angle of the transducer upwards a little bit. So remember, it was way down, you're going to move it up. So this is your mitral valve inside. This is the LV cavity. The mitral valve is right there. The anterior leaflet, this is your inferior, and the lateral and your septum. So the anterior wall, inferior wall, lateral wall, septum, anterior leaflet, and this is your posterior leaflet of the mitral valve. So short axis at the base. So this is at the mid-cavitary level where you have the papillary muscles. So you're moving the angle of the transducer upwards a little bit more now. And this is at the mid-cavity level. This is your anterior lateral papillary muscle, posterior medial papillary muscle. This is the anterior wall, inferior wall, lateral wall, and septum. Put it in play. Okay. And then to get the apex, you move the angle of the transducer further upwards. So you're moving the angle of the transducer even further upwards to get the apex. And this is the apex, or close to the apex. Anterior wall, inferior wall, lateral wall, septum. So those are the short axis view. Then you're gonna position your transducer to get the apical views. So the apical four-chamber view, you're gonna position the transducer at the apex of the heart, and a good position or a good location is the mid-clavicular line, the fourth or fifth intercostal space. The marker should be about the 5 o'clock position, and you're supposed to get the image looking like this. This is your LV cavities right there. This is the lateral wall, your apex, ventricular septum. So mitral valve is right inside there. It's anterior leaflet of the mitral valve, the posterior leaflet. This is your left atrium, right atrium, the atrial septum, right ventricle, and your descending aorta. So let's put it in motion. Okay. If you look, you can see that the tricuspid valve, which is over here, is a little lower in the ventricle than the mitral valve. So look again. The tricuspid valve is a little lower in the ventricle than the mitral valve. So the tricuspid valve is right there. This is the mitral valve. You can see it is a little lower in the ventricle than the mitral valve. And that's one of the ways you can distinguish the right side or the right ventricle from the left ventricle. The tricuspid valve is always lower in the ventricle and identifies the right ventricle. Okay. Again, in systole, the muscle thickens. So that's your apical 4. To get your apical 5, you just pull the angle of the transducer downwards a little bit. And remember, these are very minuscule movements. These are not abrupt movements. So very minuscule movement, and you'll get your nice 5-chamber view. This is color. We're not doing color. We're not doing color. Let's look at this. It's another color. Not that. All right, so the other view you're gonna get, the other apical view is apical two-chamber view. So you're gonna do counterclockwise rotation of the transducer from the apical 4 position, counterclockwise. So it's not a clockwise rotation, it's the opposite to the clockwise rotation. And you get your two-chamber view. Okay, so still color, still color. So again, from the apical 4-chamber uh, position, you're gonna rotate the transducer counterclockwise, and you're going to get a nice image looking like this. This is the inferior wall, the anterior wall. This is the mitral valve right there, left ventricular cavity, right atrium, anterior leaflet of the mitral valve, and the posterior leaflet. You put it in play. Okay, this is your two-chamber view. To get the three-chamber view, you just continue to do counterclockwise rotation. So just further counterclockwise and you'll get your apical three-chamber view. So this is your, notice it's a color, right? So okay, so this is your apical three-chamber view. Doing further counterclockwise rotation. This is your anterior septal wall. This is the inferior lateral wall. LV cavities right there. This is your mitral valve, the anterior leaflet, the posterior leaflet, left atrium, aortic valve, and the ascending aorta is right there. Okay. Apical three-chamber view, further counterclockwise rotation. And of course, we usually put color in everything, looking for abnormal flow. Um, then what you can do, your subcostal view. With your subcostal view, uh, this is the liver right there. The right side of the heart is right there. The left side of the heart. So the transducer is placed in the subxiphoid area, and you image the heart, and there are a number of things that you're going to look for in the subcostal view. You want to look at the IVC, inferior vena cava. You want to look at the right side of the heart, of course. You want to look at the ventricular septum, the atrial septum, because if there are problems with those structures, you can quickly identify the abnormality. So you also want to look at the inferior vena cava. You want to measure the width of the inferior vena cava. Okay, that's a very important part of your assessment, especially if you want to determine pressures, pulmonary pressures. So, and then you do your suprasternal notch view to round out everything. All right. So We what I'll do on Saturday, I'll concentrate a little bit more on the subcostal and suprasternal notch view. But essentially, this is